Hey everyone, welcome to Jerusalem. We're at Shaare Zedek Medical Center, and we are enjoying a beautiful sunny day on the first day of Adar. Chodesh Tov, everybody. We've been seeing groups of singing teenagers roaming the halls of the hospital. We've also been trying to shoot some videos here. We're having an interesting and productive day on behalf of the American Committee for Shaare Zedek, and we're also having a chance to catch up with a Teaneck native, one of our honorees at this past Heart of Jerusalem dinner for American Committee for Shaare Zedek, Dr. Zvi Goldschmidt, known here at Shaare Zedek as Tzvika, I understand. And let's flip the camera around and say hello to him and schmooze for a couple of minutes. Here we go. How are you?
Hi, Mayor. Great to be here again with you and your audience.
It's a pleasure. This is an amazing backdrop. We're on the 10th floor of Shaare Zedek Medical Center. Just want everybody to see this mural that's here. Could you tell us what it is?
Well, yes. There are multiple verses from the Torah having to do with lave, and they're all listed here on this beautiful piece, which is in really the center of the Heart Center.
Right, the Erica and Ludwig Jesselson Heart Center here at Shaare Zedek. So, Dr. Goldschmidt, you are a cardiologist, an interventional cardiologist, right?
No, interventional echocardiographer.
Echocardiographer.
It's a title we made up just a few years ago.
That's fantastic. Hey, why not define what you do on your own terms? Anyway, you work in New Jersey. You live in New Jersey, and yet here you are in Jerusalem wearing a white coat. What's that all about?
Well, I have a strong connection to Shaare Zedek from my family being involved with the hospital back in the 1950s and from visiting with the cardiologists here over the years on my vacations. I always find time to stop by. Last February, 1 year ago, I was actually able to get a full month off and I got a temporary medical license, and I worked here with my colleagues in cardiology doing my subspecialty, which is cardiac ultrasound, or what we call echocardiography.
It's amazing. A temporary medical license, and you can come and put your skills to work here as a volunteer.
Right.
So is that what you're doing this year as well?
Well, this year we decided that we would try to up the game and get me a permanent medical license.
How do you do that?
Well, the first thing you have to do is make aliyah, which was kind of a daunting prospect, but then I read about it on the internet, and do-it-yourself Jiffy, 26 days after deciding I was going to do it, I got approval from the Jewish agency to be an Oleh Chadash. So we got here about 3 weeks ago. I was processed for aliyah, and I am still waiting for receipt of my official medical license. But in the meantime, I've done exactly what I did last year, and I intend to be back many more times in the future to make use of my medical license. The good thing about having a license, a permanent license here, is that every time I'm in Israel, I can just come here and work for a day or two, and when I work here, the cardiologists don't have to work as hard. It's not like I'm providing them something that they don't know how to do. They know how to do everything I do. In some ways, they're better than me. But when I come here, these are very, very hard-working people, and I give them a break, and we discuss cases, and it's always nice to have an extra doctor looking at your patients and looking at their tests and giving a discussion on it.
That's
so
great.
Going forward, I'll be doing this a few times a year, and every February I'll be doing it for 3 or 4 weeks until I can finally make the big step and make the big commitment
and make the move for real.
Make the move for real. I've already made one sacrifice. I used to go skiing every February. That was the only skiing I've done. My big sacrifice for aliyah was to give up skiing.
That is pretty significant, although there's always the Hermon.
There's always the Hermon, yes.
Right, very good. So, what do you find when you get here? You're used to your working environment in Ridgewood.
Well, I work in Ridgewood, which is a community hospital that's a tertiary cardiac center, but almost all the patients are private patients, and demographically they are a very homogeneous crowd. Here, we see the opposite. It is the most heterogeneous patient population. You have Christians, you have Arabs, you have Jews, you have believers, you have non-believers, you have zealots, you have atheists. They're all here, and they all have heart disease. And what's really special about this place is the medical team here. The cardiologists who work here have all been here for many years, and they work well together. They know each other well. They know their strengths and weaknesses, so they can complement each other in that respect. The nurses in the cardiac unit, both on the floors and in the coronary care unit, there's very little turnover. They've all been here for years, and they know a lot of the frequent patients who are here. They know them and they know their families. So
That's so valuable, isn't it?
it's very valuable. It's not the alienating experience that you can get in a large teaching hospital. This is really a warm community hospital that happens to be located in the center of a very big city and functions in some ways as an inner city hospital.
With 1,000 beds and
Exactly.
and seeing 750,000 or 800,000 people a year.
And this is the place that's closest by ambulance to anyone's house that's in Jerusalem proper. So if you have a heart attack, 2 out of 3 times you'll be taken here for care, because this is the place that the ambulance will get to very rapidly. And the heart go to the cardiac cath lab down the hall, and they get their heart attack taken care of. But what's new this year is that we've opened a stroke center here. And stroke patients are treated in a very parallel fashion with heart attack patients nowadays. For the heart, the longer you delay, the more heart muscle is lost. We used to say time is muscle. Over the last 10 to 20 years, we've also learned to give clot-busting drugs for appropriate patients with strokes. And what we've learned about those patients is that time is brain. So having an ambulance bring you to a place like this as soon as possible, when minutes count, is the way to go. This year, Shaare Zedek opened up a stroke center, which is a multidisciplinary center. It's directed by a neurologist who's an expert on strokes. His specialty is now called Strokologist.
Really?
Yes.
I never heard that word before.
He's an academic strokologist. So
We're learning a new word today.
we have neurosurgeons available for patients who need to go to the OR, and we have what's called a neurointerventional radiologist for cases with stroke where the intravenous clot buster doesn't work. This gentleman is able to bring a catheter into your brain through an incision in the arm or in the groin and fish out the clot and basically minimize the amount of damage done by the stroke.
It's amazing.
Last week I had time to spend with the stroke team, and we went to evaluate a patient in the emergency room. This was an Orthodox gentleman who had been doing his morning prayers, and while he was saying the Ashrei prayer, which is a prayer that we say 3 times a day, he suddenly felt that A, he couldn't read the words on the page of his Siddur, and B, he couldn't say the words. So he was having a classic stroke with symptoms of aphasia. So this resolved fairly quickly. He was brought to the emergency room. The strokologist went to see him within 5 minutes of him getting to the emergency room. And the strokologist and the resident personally wheeled the patient over to CAT scan to determine whether he had the type of stroke that would require a clot-busting drug. As it turned out for him, his symptoms were resolving, and the CAT scan did not show that he needed that treatment, and he was admitted upstairs to the stroke unit for further testing, which is where the cardiologists come in. The majority of strokes that occur are either related to hypertension or to atrial fibrillation, the dreaded arrhythmia that causes clots to form in the heart. During a hospitalization following a stroke, we want to determine what can be done to prevent this patient from having another stroke. And the principal testing that's done is done by cardiologists. We do an echocardiogram to look at the heart chambers for abnormalities that can form a clot, and we put the patient on a monitor to see if they have atrial fibrillation, and most importantly, we make plans for outpatient monitoring afterwards to again look to see that the patients don't have episodes of atrial fibrillation. Patients who've had a stroke, sometimes they get treated with aspirin alone, which is a mild blood thinner, but if they have atrial fibrillation, they need a much stronger blood thinner. And that's why it's crucial to make the diagnosis as soon as possible.
Very interesting. So disciplines really tie together, and
the disciplines overlap greatly. Cardiologists and neurologists work together every day, and we're learning to speak each other's languages.
Fascinating. When do you expect to be back at the hospital?
Well, because I made aliyah, I need to return in 90 days because I'm leaving it just 3 weeks after making aliyah. I need to return in 90 days to get a travel document called a Tu'udat Ma'avar. Because if I don't do that and I don't have the Tu'udat Ma'avar, and I come a few months later, I could get stopped at the airport.
Wow.
So I'll be back in May. I don't mind coming back. I'm happy to come back. I have my daughter and my son-in-law in Modi'in, Alyssa and Eli Magid, and my 3 grandsons, so I'm happy to visit them. But the bonus is I'll be able to spend a day or 2 here working and making myself feel good by doing my volunteer work.
Excellent. Thank you very, very much. Not only for everything that you do, but also for spending some time with us now on Facebook Live and saying hi to our audience. And if anybody has any comments for Dr. Goldschmidt, they could put them in the comments, and I'm sure he'll be glad to take a look at them. And we're gonna sign off now and get back to our day. But thank you very much.
And I wish everybody a happy Purim.
Thank you, and Chodesh Tov to everybody. If you're in New York, if you're on the East Coast, or certainly on the West Coast, you've yet to wake up. And we wish you a wonderful day. Take care. Bye, everyone.
Bye.